Discovery of flexural waves in blood vessels could enable accurate cardiovascular diagnostics. Arterial stiffness reflects our cardiovascular health and can reveal our risk of cardiovascular illness. This stiffness can be measured by assessing the speed of the waves that travel through our blood vessels as our heart beats. However, ultrasound measurements are too inaccurate for measuring wave speeds in certain blood vessels, while optical techniques are too inconsistent. Because of these issues, longitudinal waves are typically not measured in clinical settings. The key to measuring arterial stiffness may lie in assessing the right kind of waves. Longitudinal waves are the type of wave that can be used to assess arterial stiffness. They can be visualized as follows. Imagine a force applied to one end of an extended slinky, causing a longitudinal wave to travel along the slinky. However, scientists have recently discovered that two types of waves travel through our blood vessels: longitudinal waves and flexural waves. A flexural wave can be visualized as follows. If a force acts perpendicular to the length of a slinky, such as someone raising and suddenly dropping one end of it, then a flexural wave will travel along it. The newly discovered type, flexural waves, may be more useful for diagnostic purposes. The researchers behind this new discovery include Dr. Gabrielle Laloy-Borgna and Dr. Stéphane Catherine of the University of Lyon. Laloy-Borgna and Catherine discovered that our blood vessels demonstrate both longitudinal and flexural waves at the same time, which may help to explain inconsistencies in wave speed measurements in previous research. To begin their study, the researchers used a technique called laser Doppler holography to measure blood flow in the retinas of healthy volunteers. They also developed algorithms to analyse and contextualise their measurements. They were successfully able to detect flexural waves in the retinal blood vessels. Next, the researchers turned to the carotid artery, the large artery in the neck where our pulse can be felt. They used an ultrasound probe to successfully confirm that both longitudinal and flexural waves travel along this artery. Excitingly, it was easier to measure the newly discovered flexural waves more accurately. This suggests that flexural waves have great promise as a diagnostic measurement and could assist with more precise assessments of arterial stiffness and cardiovascular health. The measurements could be easily achieved using a standard clinical ultrasound scanner. The researchers are planning further work to refine the mathematical modelling that supports their measurements. They also wish to establish parameters for healthy and unhealthy wave signatures to aid with diagnostic work. In the future, we may wave goodbye to imprecise cardiovascular diagnostics.